One.
Good morning. I'm Matthew Cameron, and I'll be your moderator for the COVID-19 update for Thursday, November 19th. We are joined today by Yukon's Premier, the Honorable Sandy Silver, and the Chief Medical Officer of Health, Dr. Brendan Hanley. Our sign language interpretation is being provided today by Mary Thiessen, and André Boursier from the French Language Services Directorate will translate any questions from French-speaking journalists. Following our speakers, we will go to the phone lines for questions from reporters. We will call you by name, and you will each have one question plus one follow-up. Before we begin with our speakers, I'd like to verify that everyone can hear us. If any reporters are having a problem, please send an email to ecoinfo@gov.yk.ca. Premier Silver.
Thank you, Dr. Cameron. Good morning, everyone, and thank you for joining us here on the traditional territory of the Kwanlin Dun First Nation and the Ta'an-Quachin Council. I want to start by thanking Yukoners for continuously practicing the Safe Six. We watched the second wave of COVID-19 unfold across Canada and including here in the north, and I want to thank everybody for being so vigilant. Yesterday we announced a new case of COVID-19 in the territory, bringing our total case count to 26. We also issued a public notification for various locations in Whitehorse in the past few days. Now, Dr. Hanley will share more information about that in a moment, but I do want to say that now is not the time to panic. Public notification means that individuals that may have been in certain areas, certain locations at certain times, should self-monitor for symptoms. It doesn't mean that the businesses or other facilities have done anything wrong or that there's any danger in these locations. I want everyone to stay vigilant and to stay calm. There's no need to go emptying shelves of grocery stores either. There is no need to spread rumors or misinformation about what's happening. Our healthcare system remains very well prepared to deal with COVID-19 cases in the territory, including our capacity for testing and contact tracing. The best thing that you can do is, again, to continue practicing the Safe Six. Stay informed and follow public health recommendations, which all obviously can be found at yukon.ca. Over the last week, the number of COVID-19 cases has been rising here and across the country, in some cases very dramatically. We have been watching other jurisdictions closely, and in particular, we've been thinking of our neighbors, our northern neighbors, and sending courage and strength to our friends in Nunavut as cases rise in their territory. The Yukon is currently in a state of emergency, which is integral to our government's response to the COVID-19 pandemic. The state of emergency allows our government to act quickly and to respond to the spread of this disease in order to protect and support Yukoners. Our actions throughout the pandemic have been guided by epidemiological data and the recommendations of the Chief Medical Officer of Health. As you all are aware, the situation changes rapidly. COVID-19 numbers are accelerating quickly in jurisdictions across Canada, including British Columbia and Nunavut. In light of these surges, and following a recommendation from the Yukon's Chief Medical Officer of Health, we are ending the BC territory mobility bubble and expanding the self-isolating requirements to all of those entering our territory. We announced last night that as of Friday, November 20th, anyone entering into the Yukon will be required to self-isolate for 14 days. Now, this applies to people visiting Yukon from other regions and Yukoners who are returning from travel outside of the territory. Travelers and Yukon residents returning home must have a self-isolation plan in place before entering the territory. All those will be required to sign a declaration. Critical service workers do not need to self-isolate as long as they are following the guidelines put in place by the Chief Medical Officer of Health and are traveling and returning to Yukon for work purposes. People transiting through Yukon are still required to stay on the designated route, which has not changed. Residents of communities of the BC Yukon border areas such as Atlin and Lower Post who depend on Whitehorse to access amenities and essential services will continue to be able to enter Yukon without being required to self-isolate, provided that they have not traveled to the rest of British Columbia or other parts of Canada in the previous 14 days. Now, we are evaluating current border enforcement efforts to consider what changes need to be made to ensure that those entering the territory are aware of these updated requirements. Now, this decision was not made lightly. We know that reinstating self-isolation requirements for these jurisdictions will have impacts on our businesses who have worked to open to visitors from British Columbia, as well as on Yukoners who have planned to travel or to host visitors that are from other provinces in the coming weeks, or from that province in the coming weeks. I appreciate that this is not welcome news to a lot of Yukoners. However, we must consider what is needed to keep Yukoners safe. And this measure will assist us to limit the importation risk of COVID-19. The new cases we have seen in Yukon recently, combined with the dramatic increases in cases in Nunavut and British Columbia and across the country, made this a very necessary decision. I have also heard Premier Horgan's call to restrict non-essential travel within Canada. We support BC's efforts to limit the spread of COVID-19 in that province, and we must do our part to contribute to the national effort to contain this disease. At this time, our government does not recommend non-essential travel outside of the territory. We also ask Yukoners to think carefully about the need to travel within the territory and to do so respectfully and responsibly. Yukoners, we are at a turning point. It is time to reset and collectively renew our commitment to practicing the Safe 6 steps in staying safe. It's not just doing it for yourself, it's doing it for your neighbors, for your friends, your colleagues, and your fellow Yukoners. We need to work together, as we always do, to keep COVID-19 numbers low in our communities and to keep each other healthy and safe. We need to treat one another with kindness and respect and patience as we work through what continue to be challenging times. I urge all Yukoners to continue to reach out to loved ones, to friends, and to neighbors, support each other, and offer the help where you can. This pandemic is taking a very serious toll on each and every one of us, and I know that it's not easy right now, but again, I know that together we can and will get through this. And remember, the most accurate and up-to-date information about COVID-19 in the territory is found on yukon.ca/COVID/19. Thank you very much. Masi Sho, Ganesh Jish. Over to you, Dr. Hanley.
Thank you, Premier. And good morning, bonjour tout le monde. I hope everyone is staying well. This week, almost every part of the country is facing challenges with COVID, and yes, Yukon is no exception. It was only shortly following Tuesday's media update that we confirmed case 25 as a positive contact of a previous case, and now since yesterday we have confirmed our 26th case in Yukon. Case 25 was linked to the previous case announced on Tuesday morning, which was the result of out-of-territory travel. The individual is recovering well at home while in self-isolation. Our latest case, number 26, had a number of public exposures, which we published yesterday evening, in addition to numerous household contacts. This individual did not travel outside of the territory, and the source of infection has yet to be identified. In this case, we are again pleased that the individual did self-isolate and sought testing as soon as symptoms occurred. Contact tracing clearly is continuing. There are a number of household contacts, and in addition, the individual visited the multiple places listed in the exposure notice before onset of symptoms. I won't go over the notifications in detail, but they are as posted yesterday and on the website. For those who were at any of the mentioned locations, I ask that you please monitor for symptoms, and if you are experiencing symptoms, Whether it be a slight tickle, loss of smell or taste, a dry cough, or other symptoms in the list, you must stay home and arrange for testing immediately. If you do go to get tested due to symptoms, please mention the exposure location that you are at. For the rest of us, it's important to reiterate, even more as we see rising cases, how important it is to stay home and self-isolate and arrange for testing when you are feeling sick. I understand you've heard this, we've all heard this a million times, but I know it's always different when it happens to you. You may just not want to bother, or it may be difficult to miss a shift or a day at the shop. Be aware, though, even if you're feeling just a little bit off, take some time at home and see what's going on. When you have any symptoms, avoid going out. Get your groceries safely delivered, work from home if you can, and don't visit anyone who's outside of your household until you can get tested and get further direction. I know everyone wants to hear more about the BC bubble or the divorce, but I want to first reiterate a few messages that are so important as we're experiencing this second wave in the country. Due to the surges in Canada, we are now getting many people who are calling YCDC because they have been identified as a contact of someone down south. For example, someone is here in Yukon for a visit or for work and is named as a contact from someone in one of the provinces and comes forward for testing due to symptoms. Or someone else has traveled down south and later, when back home in Yukon, is named as a contact. These check-ins with public health are a good thing. We want people to call when they are named as contacts. But the increasing number of calls does reflect that there are simply many more cases than we were witnessing even a few weeks ago. And what we are learning from these contacts and from cases around the country again relates to the settings where we see transmission occurring. Transmission is occurring, for example, between staff in a workplace. Transmission is occurring in a household, especially where people are mixing or working in multiple locations and then bringing infection back into the household. If you are sharing a household with others, have you thought about how many contacts each person has with others? So if one of those contacts were to be infected, how many chances are there to bring that infection back into the household if COVID is circulating in the community? And how many further infected contacts could occur? It's a good exercise to think through. Transmission can also occur between healthcare workers, most often at gatherings in the community or in common shared work areas. So whether a healthcare setting, a retail establishment, or a public service, you must have your workplace set up to prevent transmission. If you have gotten away with it so far, your time may shortly be up. The next time, you could get stung. And if you catch COVID, you can pass it on, perhaps to many, perhaps to people who can be severely affected or who can die. Small household gatherings and workplaces are two of the main areas in Canada where transmission is occurring. We know, or should know by now, to stay away from others when sick. As we see the rest of Canada continues in its climb in cases, it really is of the utmost importance to take your symptoms seriously. And the chance of an illness, especially with cough, fever, or difficulty breathing, being COVID, increases substantially as the level of COVID rises. We have seen many cases throughout the country of individuals who felt a tad under the weather and continued on with their daily routines, running errands, going to work, even attending gatherings, not taking their symptoms seriously and then finding out they were a cause of an outbreak or even the onset of community spread. We need to avoid this type of scenario, and the way we do that is by ensuring we are following the orders and the guidelines that are in place. But apart from being around others when sick, we know those few days before infection sets in are also crucial days for spreading the disease. That is why, whatever the results of the recent case introductions here, we must continue to live like COVID is already here. I hope that recent increased case activity, either here or in Nunavut or increasingly in BC, are all good reminders that we need to do this now. Which brings us again to the Safe Six. Following these guidelines are critical in reducing your risk of contracting COVID-19. Maintain physical spacing at all times when not in your household bubble. Maintain proper hand hygiene by washing your hands frequently and using hand sanitizer. Again, if you feel sick, stay away from others, stay home, get tested. Keep gatherings small, safe, and legal. Respect the wishes of communities when you travel. And self-isolate whenever required to by law or by public health. And then there's the seventh step of the Safe Six. Wear a mask whenever required, or when asked, or when circumstances make physical distancing challenging or difficult. As the Premier mentioned at the last briefing, a second wave is definitely already affecting Yukon and is literally on our doorstep. We knew this was coming and we have been preparing for it. What we do from here, though, is definitely up to us. As I said just the other day, in these times of anxiety and stress and worry, we should remember that there is so much that is still under our control. Fear can be an overwhelming feeling, but we can't let it control us. Remember, you are taking the right steps and can reduce your risk by following the precautions. So Yukoners, please follow the Safe Six, be patient, and stay calm. I know many of you have been anxiously watching the rest of Canada, especially BC, and offering opinions and advice on whether to preserve the bubble or to let it go. As said only the other day, my team and I have also been daily watching the tally, analyzing the numbers and data as best we can, and watching what restrictions are being applied in which areas. We, of course, have continued to work closely in partnership with BC. BC's ability to manage cases and trace back cases and clusters to known sources and their early imposition of restrictions all have been impressive to watch. But nevertheless, cases continue to mount and projections in BC are for a continued surge. Meanwhile, the Premier of BC just yesterday advised against all non-essential travel into the province from other territories and provinces. Travel restrictions will also be extended in the province for at least another 2 weeks. So even though we still have not had cases directly linked to the BC bubble, we recognize that the risk is increasing, while at the same time we are seeing more and more Yukoners identified as contacts of cases down south, or identified as cases that are themselves linked to travel. We are aware that this worsening situation poses an increasing risk of introduction of COVID into our territory. Given the increasing risk of multiple cases or outbreaks in Yukon and the increasing case activity in BC, I therefore gave my recommendations to Cabinet yesterday that government consider suspending the BC bubble until such a time as we see cases in BC stabilize. We will need to get to a point that we are once again comfortable that cases are contained and the curve is once more flattened. So as the Premier announced, the 14-day self-isolation period will be reinstated as of tomorrow, meaning any person who is visiting BC, except for the conditions outlined by the Premier, must self-isolate immediately upon return in Yukon. For those who are planning to travel in the upcoming weeks, I recommend that you reconsider your travel plans. I know many have had trips planned to BC, and I'm sorry to say that these should be cancelled or rearranged. But we are in a time that requires solidarity, concerted action, and some sacrifice. We, of course, will continue to stay in close touch with and monitor the evolving pandemic in BC. If we do get back to that point of stability and comfort, I will adjust my advice accordingly. These decisions are so difficult to make, and we know We know there will be families and friends, students and visitors with broken hearts. But I feel this decision is in the overall best interest of Yukoners at this moment in this difficult phase. It does feel a bit like going backwards, but in other ways this will give us more security to reinforce our capacity here to meet the COVID threat and allow us to continue to move forwards. As mentioned the other day, we are looking at a potential mask policy and will shortly advise Yukon government on what a mask requirement would look like. Meanwhile, please continue to wear a mask in any setting when required to, asked to, or where physical distancing is difficult. But please don't let a mask override the Safe 6. Masks are an additional layer of safety, but they will never in themselves be the ticket to protection. As this is an interim update, I will keep it short so we can address questions. Thank you. Merci. Merci.
Thank you, Dr. Hanley. Thank you, Premier Silver. We'll now go to reporters on the line, starting with John Kennedy with CKRW.
Hi. My first question, I'm wondering when Yukon will enable the COVID Alert app in order to, help with tracking and assisting COVID cases, as well as enabling people to be aware if they've come into contact with someone who's registered as a positive case.
Thanks, John. We're still working with the federal government. We believe in the app. Dr. Hanley and I have been here before talking about how in Yukon tracing is done exceptionally well, and how this app is more helpful for Yukoners traveling traveling to other provinces. Whereas in the tracing is done well right now, there's not a pending urge for that, although I am pushing for the app to be registered here because, mostly before the bubble collapsed, but, people going out and traveling into Vancouver, it would be very helpful. Other jurisdictions are coming along slowly. There's definitely issues, and this is a conversation that is still live at the Council of the Federation and with the First Minister's meetings. I wish I had a timeline for you right now, but I don't. But it's on the it's always on the updated agenda for those conversations with the premiers and with the Prime Minister.
Yeah, I'll just add. I don't know if I want. Actually, I'll just add to that it is something we continue to look at and prepare for. There are. And I've said this before, but there really are some practicalities of how useful the app would be in our jurisdiction. As a small jurisdiction where we do have good contact tracing capacity and surge capacity in contact tracing, we are there are these small jurisdiction considerations where it's difficult with the app when it's registering contacts that have not been screened as to how significant they are, how close they are, what kind of settings they occurred in, and how long that contact was. So that there's basically there may be signal, but there's a lot of noise along with the signal. And therefore, it has a potential to add a lot of additional work to public health without clearly showing a benefit. So we are working, as the Premier said, we're working at a number of tables in looking at how the app might be either adjusted to be more appropriate for us as a jurisdiction. We're also looking at what other options, what other similar options might be out there, and talking about this with our colleagues in BC as well.
Thanks, John. Do you have a follow-up question?
I do. Dr. Hanley, you did talk about how a mask mandate is being looked at right now. I'm curious as to what exactly goes into considering a mask mandate. Wouldn't it just be easy enough to say, yeah, everyone wear a mask? Or what's behind it?
Yeah, you'd think it would be, but actually it's not, because and I think I mentioned a number of them last time, and I'll see if I remember them. But there are things like Okay, what about someone who doesn't wear a mask? How do we enforce that, and who does the enforcing? What are the mechanisms and what's the process for enforcement? What about an exemption? How do we verbalize an exemption process? What about someone who has trouble finding a mask? What are the obligations carried out to enable access to mask, and on whose shoulders rests that access? So there are a number of those other issues that and we know that different jurisdictions have handled this differently. Different jurisdictions have languaged the policy differently. There are differences in which settings the requirements apply to. There are important aspects of which jurisdiction are we talking about, and which jurisdictional practices apply. So if we're talking about city versus territory versus First Nation government versus community, there's do we talk about this in small rural settings as well as urban settings? So there's really a lot of this, and rather than just say it and then try to scramble and answer all the questions and address all of these policy issues, we want to kind of have that package ready to go. So it's not that we're not interested in doing this. We just want to do it right the first time.
And I'll just add to that. One of the main conversations that Dr. Hanley has had with me over the months and weeks was the public acceptability piece as well. And, anecdotally, I remember in Dawson before the case where we were asking folks if you're in certain areas and if you're symptomatic to go get tested, not a lot of people were wearing masks in my community, but a couple of people. And now, when things hit closer to home, after events like that, the acceptability goes through the roof. And so one of the things that we were monitoring for a long time here was public acceptability as well. We know that Yukoners are there. Look around the rooms that you're in, and you'll see that the majority of Yukoners have absolutely signed on to mask wearing. So I can't thank Yukoners enough for being so vigilant. And again, we have our Safe 6, and now we have the extra 7 added on. I like how you said that, Dr. Hanley. And I know that Yukoners, for the most part, are going to be very accepting of this practice. So thank you.
Thank you. We'll now move on to Marine Laurent-Boréal.
Merci beaucoup. C'est une question pour le docteur Hanley. Quelles sont les raisons qui vous ont poussé à changer les mesures aussi rapidement? Tout s'est passé assez rapidement. Est-ce que vous considérez que le cas numéro 26, le 26e cas, est un cas de contagion communautaire, community spread?
So the question is for Dr. Hanley. What are the reasons why you're changing the guidance so quickly? Is it because we have these new cases, and is case number 26 be considered community spread?
Donc, merci. C'est une question dans 2 parties. Donc, je vais peut-être répondre aux premières questions, à la première question. Il s'agit des raisons pour avoir cette recommandation. Et c'est, clairement, on était en train d'observer la situation à très proche et plus en plus proche, journalier. À Colombie-Britannique, on a reçu beaucoup de correspondance de la public, de poser des questions. Est-ce qu'on va changer les règles? Et puis avec les prononcements de Dr. Henry et le gouvernement de Colombie-Britannique dans les semaines passées, 2-3 semaines passées, qui ont décrit une situation qui était en train d'empirer. Et au même temps, avec les données qu'on a accumulées, qu'on voit un risque d'importation qui est en train d'augmenter. Donc, tout ça, avec les projections de Colombie-Britannique, avec les restrictions qui étaient maintenant en place, avec les conversations avec le docteur Henry, à ce moment-là, c'était le moment où, je pense, on est tourné pour dire que le risque est assez, qu'il faut, on a recommandé au gouvernement de changer les règles. En fait, c'était rien à voir avec le cas 26. La décision dans ma tête était déjà faite cette semaine et puis on avait les nouvelles depuis hier matin de cette nouvelle cas. La question, est-ce que ça représente transmission dans la communauté? En bref, on ne sait pas, mais c'est normal qu'au début d'une investigation, souvent on connaît pas la source de l'infection. Donc l'effort plus immédiat, c'est pour identifier les contacts, pour notifier le public et de continuer de ramasser l'information qu'on a besoin pour déterminer. C'est possible que ça représente une source inconnue. Si on a une source inconnue avec une transmission qui continue dans la communauté, ce sont les critères pour transmission communautaire. À ce moment-là, on n'a pas assez d'informations de dire que ça représente transmission dans la communauté. Toujours, on est en train d'investiguer.
Would you mind repeating in English?
Translate?
Yeah, at least the stuff you haven't covered from your
Sure,
works.
I will translate. I think the first part of the question was around the reasons for the recommendation, and the and I think it was around like a rapid, why the rapid decision, and whether that had anything to do with the case 26, and so I wanted to separate those two, and I see this as really, obviously, a thing we have been watching more closely every day as the situation in BC has been worsening, following the advice being given by Dr. Henry for her province, as well as the restrictions and the projections and the modelling in BC. So it really kind of came to a point at which, as we measure the importation risk, as we look at upcoming travel, and as we look at the BC projections, that it really came to a point where the risk, in my mind, was enough to recommend the change to the government, which is what I had arranged to bring to cabinet yesterday after requesting an audience with the Premier and Minister Stryker the day before. So really, this had nothing to do with the case 26. Case 26 was coincidental and came yesterday, as I often feel we're sometimes in a bit of COVID karma, and sometimes our decisions are accompanied by other events that may be that are coincidental, but may help further the argument for making that the case and making the case for that change. Another example, of course, was the announcement from the Premier of BC yesterday, which really helped to, I guess, support the recommendation that we were already preparing. And as the Premier announced, in BC, no non-essential travel within BC. So that was really...
There was a bit of a community spread.
Oh, sorry. Yeah, this is a very long answer, but you doing okay? Yeah. Okay. The question was whether this latest case of 26 represents community transmission. What I wanted to say is we don't have enough information to say that yet. What you need to say if there's community transmission is, number one, you have an unknown source. So there's no travel link. You can't figure out where the source acquired the infection from, and you have ongoing transmission within the community. And so we don't have those criteria fulfilled yet. We're still investigating the source. Our immediate focus with any investigation, especially one like this where we have significant public exposures, is really to concentrate on the forward part. How do we just get around this quickly? Identify all the possible public exposures, even though some of them are precautionary, and then do the immediate household contact tracing and that sort of a traditional contact tracing of, who are the contacts going back. Identify the contacts, make sure that they are notified, that they do the self-isolation, they monitor, and that we test them when appropriate, either because of their risk status or because of the presence of symptoms. So those are all the sort of immediate steps. Remember, this is only since yesterday morning. We will be obviously continuing the investigation in the next few days.
Merci, Marine. Avez-vous une autre question?
Non, merci. Il y avait déjà 2 parties à ma question. Merci beaucoup.
We'll next go to Stephanie with the Yukon News.
Yes, I'm wondering if the current situation will result in increased enforcement in terms of infractions.
So we are, as I said in my opening comments, we're evaluating border enforcement's efforts to consider what changes need to be made to ensure that those entering the territory are aware of the most updated requirements. I know that Minister Stryker and his team were working on changing up models anyway, even before this announcement. So this will pivot very nicely into those other conversations. We're very pleased to be working in partnership with Liard First Nation on this initiative as well. I think the minister and his team have done an exceptional job to ensure that the enforcement officers are in place right across the territory as well. So enforcement officers are in most communities. They continue to work closely with all levels of government. We had a very good conversation with 2 ministers and Dr. Hanley last night with mayors and council, chiefs and council. If the question is about if we think that there's going to be more enforcement, we've been seeing a steady amount of calls in at the helplines. We've seen an increase in fines given out in the last couple of weeks. We are asking people again that if you notice things, as opposed to approach people, call the lines and help us with that information. Be very respectful to individuals, but at the same time, sharing information is critical as well for enforcement for fees and fines. But with any change in the phases, we do notice changes to trends. But I think it's too early to determine whether or not there's going to be more enforcement based upon people not doing what they're supposed to do.
Thanks, Stephanie. Do you have a follow-up?
Yes, I know we've talked a bit about masks. I'm wondering if there's any contemplation about other further restrictions.
Yeah, I think Dr. Hanley is pretty clear that this is something even before this particular provision, going back and with the bubble, we've been having this conversation already. Nothing at this time. We're not announcing any changes today. Masks are, as we know, required now at places like the Canada Game Centre. I talked with Mayor Curtis before his government implemented those changes, and also to some other places of business. Dr. Hanley was clear today that it's very, very important to respect the businesses, the requests of businesses and organizations to wear masks, and that at this point, these policies, again, they're very precautionary measures. They are meant to protect the health and safety of Yukoners. But I completely agree with Dr. Hanley. The Safe 6 is the most important things that we can do right now, and wearing of masks. There'll be most likely news to follow on that, but we're not making any new recommendations or policies at this point.
Thanks. We'll now go to Philippe, CBC Yukon.
Yes, my question is, will we see an effect on non-urgent or medical visits in Vancouver? What about Yukoners going for medical visits?
Do you want to start with that?
Yeah, well, I'll try. I think there clearly needs to be, again, recognizing that this is an announcement that's made. Obviously, as soon as the decision is made, that this is a direction that that cabinet is taking. We wanted to together get the message out as soon as possible. But there are a number of sort of categories and subcategories and clarifications around that I think we need to communicate in the next day or so to make it clear, like what are the expectations and requirements, and that Philippe being one of them. So that's about all I can say at the moment.
Yeah, and I would just add as well, when we're talking about medical travel outside of the Yukon, we have to consider the new provisions that BC has put in. Again, analyzing what this means and having those conversations. And I know the Departments of Health are in constant conversations, but in this case, it does take two governments to coordinate new provisions. At this point, our understanding is that BC is just saying no non-essential travel, but to figure out what that means for the healthcare systems and for Yukoners traveling down there. It's definitely an ongoing conversation, and we'll be updating Yukoners to any changes to the current status quo as those conversations continue.
Thanks, Philippe. Do you have a follow-up?
I have a follow-up for the Premier. This is 8 months into the pandemic, and I'm sure Dr. Hanley has been working tirelessly every day. What supports are we doing so that our Chief Medical Officer of Health does not burn out? Dr. Hanley, are you getting enough support in your role?
That's a very, very good question. I will say, his support staff, Dr. Elliott as well, the team are fantastic. The dedication that I've seen throughout this 8 months of the medical community, of Dr. Hanley's office, has been extraordinary, and we're very, very thankful. But I agree, Philippe, you heard it in his voice today. This is tough. So we want to make sure that everybody's taken care of, and that starts with our Chief Medical Officer of Health for sure. And when we have our regular meetings, we check in on Yukoners, but I definitely check in on Brennan as well.
Yeah, thanks, Philippe. Just to add from my personal, it's a very gracious question, and I just want to echo everything the Premier said, that I'm sort of the visible face of maybe the top of the pyramid, but there's a fantastic team supporting me. So I'm so grateful for that support, and that's what keeps me going, as well as, of course, my family. Thank you.
Thank you. We'll now move on to Clariane, Radio Canada.
Yes, perhaps a more concrete question to lighten it up. Dr. Hanley, est-ce que vous pouvez nous dire si les règles entourant l'isolement ou la quarantaine à la maison pour les visiteurs, pour les gens qui arriveraient de l'extérieur ou qui reviennent de l'extérieur, est-ce que ces mesures-là s'appliquent à toute la maison et tous les gens qui habitent dans la maison?
Question is for Dr. Hanley. The new directives that you gave about quarantine and self-isolation for travelers coming to the Yukon, do you see these directives being applied to the whole household of visited by these people coming in?
Merci Claudiane pour la question et pour changer la tone. C'est une très bonne question et c'est aussi un élément qu'on va essayer de clarifier, surtout pour les étudiants qui sont toujours en train de rendre visite pour les vacances. Donc, et ça dépend de la situation dans la maison. Et par exemple, s'il y a le moyen dans une maison pour avoir toutes les conditions nécessaires pour joindre les recommandations pour qu'est-ce qu'il y a self-isolation ou la quarantaine. Donc, c'est bien écrit sur le site web. Mais on sait toujours que ça peut être un choix pour une famille de partager la maison et c'est naturel pour par exemple un étudiante qui veut être avec sa famille et donc ce cas-là tout le monde, oui, peut être dans la même état de quarantaine jusqu'au point où la personne part et puis quelques jours après. Et ça aussi, on va clarifier avec les points par point qu'est-ce qu'il faut. Si la famille choisit ou si les conditions sont dans la maison permis pas les conditions pour quarantaine individuelle qu'est-ce qu'il faut pour toute la famille pour quarantaine ensemble. Maybe I'll repeat that. It's also the question again about how do you self-isolate if you're coming to visit? If, for instance, you're a returning student and you're going to spend the holidays with your family, and does the whole family need to isolate? And it really depends on the setup of the household and the wishes of the family. So if the household is such that you can, so usually what we require, and this is laid out in the on the website, if you can have your own bathroom and then avoid sharing of food and various conditions, then you can actually self-isolate within the house successfully and then leave. But we realize that maybe is not always what the family wants. I mean, clearly, if you're having a reunification, you may want to bubble together, and so that's also possible. But then the whole family has to live under those conditions of self-isolation until the person leaves, and then with a kind of a few days after that. And that's what we're going to just clarify more specifically, probably by the next media update, like exactly what does that mean in terms of your duties after the person goes back, leaves back for university or wherever they have come from.
Merci Claudiane. Avez-vous une autre question?
Oui, donc, est-ce qu'on est rendu au point où on recommande aux gens de rester à la maison, d'éviter d'aller dans les commerces, les restaurants? Est-ce qu'on revient à cette période-là, là?
So are we going back to directives about staying home as much as possible, trying to avoid going to public places and commerce? Is it the period we're going back into right now?
Oui, merci et non. Donc, selon mes conseils, au moins, je pense que non, on n'est pas à ce point-là. On a et on est en train de réviser et revisiter les plans qu'on a pour la resurgence ou pour la réponse si on a une accumulation de cas ou la transmission dans la communauté ici. Mais on n'est pas à ce point-là. Ça c'est ce qu'on a fait maintenant avec la fermeture de la bulle, c'est vraiment, je pense, un moyen de réduire le risque d'importation et de nous permettre de continuer avec les mesures qu'on a en place à ce moment. Again, I'll translate and then let the Premier add any comments. So I want to say that no, I don't see that we're in the point of having further societal measures. We are looking at our resurgence planning that we've had all along. We're revising and revisiting that so that we are ready with our advice as to what we might have to do and in what order. But no, I don't feel we're at that point. I think really this is about addressing risk and reducing importation risk of cases, and it really is another measure in addition to the mask requirement that we're working on. Really, that's sort of it for now to really allow us to continue as we are.
Yeah, I completely agree. And, the way I look at it is Yukoners we're used to hunkering down in the winter. This is definitely not that normal hunkering down. But by closing the bubble, I want to remind Yukoners, that now more than ever, businesses really are relying on you. It's the Christmas season. Maybe limit your Amazon.ca and increase your spruce bog. We want to see people visiting restaurants and businesses. We want to see people engaging and keeping people's spirits up. But we really, now more than ever, really need you to do it in a very, very safe manner. Dr. Hanley and his team have worked very hard to set up the guidelines for keeping businesses open. This unfortunate step has hopefully a positive nature to it, which is Yukon spirit needs to shine now more than ever. And I think that's really important. Coming into the Christmas holiday season, I want everybody shopping local, and I want to see people, enjoying themselves safely and keeping everybody's spirits up into the holiday season.
Thank you. We'll now go to Beth with Canadian Press.
Hello. So you pretty much answered all my questions about community spread and the extent of these new regulations. But I did wonder, you mentioned ever so briefly, are you really calling this the divorce?
That's the first I heard of it, Dr. Hanley.
Obviously, with a little hint of irony, but it's again. I think it goes back to I won't break down this time, but these are difficult decisions to make, and BC is a very close partner to us, so it does feel like a bit of a separation. Obviously, I talked with Dr. Henry before this. We remain good friends, and we continue all of our strong links with BC that we are so fortunate to have, and that's in the laboratory capacity, the kindness and the support that they offer way above and beyond what they need to do, where we really feel like a partner. As small as we are, we're certainly so supported by BC and work and continue to work very closely. So really, it feels obviously a bit when you pull apart like that. There's a bit of that divorce element, but it's an extremely amicable divorce.
And really, what we're doing, jurisdiction to jurisdiction, is supporting each other. That's what's happening here. We have an amazing relationship. I have a great relationship with John Horgan, with Carolyn Cochran, with Joe Sigaviktuk, and these provisions are on a long-term basis going to make us stronger together, more supportive of each other. We've said this a few times on these calls, just how amazing the Canadian spirit is on these national calls, whether it was with the chief medical officers or with the premiers, every jurisdiction lending support and coming together. And what you're seeing here between ourselves and our good friends and family in BC and Northwest Territories and Nunavut is actions that are going to strengthen our relationships with these amazing jurisdictions.
Thanks, Beth. Do you have a follow-up question?
No, that should do it. Thanks.
All right, I'd like to thank everyone for their time today. Please continue to follow the Safe 6. Stay up to date on information at yukon.ca. Our next COVID-19 update will take place Tuesday, November 24th at 9:30 a.m.